Are you looking for the best workflow when it comes to utilizing your Archbridge kit for post-day of surgery? Patients all healed and we're finally ready to restore to a final prosthesis. My name's Tess with ROE Dental Lab, and today I want to talk a little bit about some of the workflows we have available for you and your patient. I want to break them down, most importantly by scenario, because we know day of surgery doesn't always go as planned. So let's talk about the two different scenarios the patient can come to us in. First being, maybe something happened day of surgery, we decided not to load the implants and we placed a healing denture on our patient. Patient's gonna go ahead and come back in the office. You're gonna wanna take that healing denture out, take a wash impression inside the healing denture. We wanna see the healed tissue. At that time, you can swap out your MUAs for healing caps if you don't want any material to get down into the MUA, but we wanna see that healed tissue. Once you take your wash impression inside that healed denture, we're gonna then have you capture a 360 of the denture. So we wanna see all the way around the denture. After that, we're then gonna have you put your Archbridge units into the mouth and go ahead and capture your Archbridge scan. So taking off those healing caps, putting the MUAs back on, capturing your Archbridge scans inside the mouth. Preceding that, we're gonna need an opposing as well as a bite with that healed denture in, and you can go ahead and send those series of scans to ROE. Now let's talk about the second scenario. Things went amazing day of surgery. ROE did our design service and we were able to print and load a prosthesis in office. Everything went just as planned. We're gonna have you go ahead and bring the patient in, capture upper, lower, as well as a bite. Go ahead and take the patient's temporary prosthesis out, capture a tissue scan, insert the Archbridge scan bodies, capture one more scan with those, and send it to ROE. From there, it depends on which material you like to go with for your final direct to multi-unit restoration. If you'd like to go with our Graphin Nano, our GCAM prosthesis, you can go ahead and go right to a printed try-in. If you'd like to go to our TLZ with a bar reinforcement, you can go right to printed try-in. And if you'd like to go to just a full zirconia final restoration, we're gonna go ahead and have you do an iJig next and then a printed try-in. So a couple different options there for workflows. We have some helpful information on our website, breaking those workflows down for you as well, that you can check out with the link right here. If you have any questions, our technicians would love to chat with you about your case and how we can help you get started. Feel free to contact us directly about how we can help. Thank you so much for tuning in, and make sure to follow us for the latest and greatest Archbridge workflows.